Okay, welcome to the last learning objectives for this module. And for this video, we are going to discuss we're going to discuss stakeholders in healthcare. So, who are stakeholders? I've touched on this in the first learning objectives. In the first module where we talked about, I gave you an overview of the U.S. healthcare system, and I explained the different the different stakeholders in the U.S. healthcare system. Where we have patients, we have providers, we have insurance, we have pharmaceutical companies, and a whole bunch of people. So the U.S. healthcare system has a lot of stakeholders, and some of them, wielding quite considerable power in the way decisions are made in the US. So stakeholders' decisions directly affect health equity because they hold a lot of power and influence in deciding who gets access to care, what quality of care is available, and how resources are allocated to different populations and also to different health services. So it's very, very important when you're working with stakeholders to identify their roles and the motivations that they have in helping in designing policies and strategies that will achieve inequities and help improve healthcare delivery. This is because each stakeholder group operates within these distinct incentives, priorities, and limitations, which make it complex when they are interacting within the healthcare system. But as a population health manager who is having to negotiate relationship with all the stakeholders, you need to understand the complexity of their interactions while finding a way to maximize your interaction or your collaboration with them. So the interactions with the healthcare with the stakeholders, both within themselves and you interacting with them, it can collectively determine health outcomes and resource distribution. So this is why understanding stakeholders and understanding how to work with them and understanding some of the things that drive them in terms of incentives and priorities is very, very important as a population health manager. So, stakeholder collaboration is critical when it comes to addressing systemic barriers. And it's not something you can choose that you're only going to work with one group of stakeholders and ignore the other group of stakeholders, because you would not be able to really address systemic barriers if you have that approach to stakeholder relationship. Because the only way to really get equitable decision to do equitable decision making, and most importantly, create sustainable population health improvement, is through stakeholder collaboration. So you want to, as much as possible, try to work with multiple stakeholders when you're trying to achieve a population health goal. So we're going to do a little scenario analysis, but before we kind of do that, let's just do a little bit of conversations about how stakeholder efforts work on achieving population health outcomes. So it very much depends on the coordinated efforts of multiple stakeholders in deciding first of all, deciding what population health goals to target, and how the strategies that you're going to try to target it, and who are going to be involved in implementing that. So multiple stakeholders will be involved, and having their coordinated efforts is key to achieving all of this. So it's through collaborations that this different stakeholders can align their efforts to achieve something like reducing diabetes rates, reducing hospitalization, and stuff like that. So even though each group are coming to the table with different priorities and different incentives, in order to work together in effective partnership in order to achieve your population health goal, you have to discover or find some form of shared goal between them. It could be reducing healthcare costs, it could be improving patients' health, it could be addressing disparities. So you're not going to approach your stakeholders by viewing some as the big bad wolf and some as the little lamb. So you have to understand that it is possible to have a shared goal. There may not be too many of those shared goals, but there would be some that you're able to have among you. The majority of your stakeholders is very unlikely going to be all of them, but you could find a shared goal with some of your stakeholders, and all of them, those that you're able to achieve a shared goal with, would all effectively work together towards achieving that goal. So, in an ideal world, your stakeholder collaboration is able to ensure a solution, a population health solution that is sustainable, that has population level impact, that through which you can achieve preventive care, education policy change, health systems improvement. That's an ideal world where you're able to get all of this done. In practice, you may want to kind of do some trade-offs. You may have to, take what you can get, and what you could get is policy change, even though it's not going to directly impact health systems improvement, at least in the short term. Or what you could get is preventive care, even though it's only going to have minimal population health impact with the larger population. Maybe within the vulnerable population, it will have good impact, but with the larger population, not so much. So, like I said, a lot of the times, what you get out of stakeholder population collaboration is taking what it is that you can get, and not going for the most ideal of the ideal. So let me use this scenario to kind of explain what I mean in terms of taking what you can get. So let's say there is a mid-sized city that is facing a rising rates of chronic diseases such as diabetes and stuff. And this condition is disproportionately affecting low income neighborhoods and communities of color. And you have all of these different stakeholders, and they all have, like I said, different incentives and different priorities. And say you have your patients, and the concerns that they have is that they lack trust in the healthcare system, having experienced generations of discriminations or neglect. And then you have your healthcare providers who are working within very limited time to see the patients, and have very limited resources, and therefore they are not able to address social determinants of health. And say you have nonprofits that work within that community, whose focus is all about securing funding and ensuring that the programs that they have secured funding for are reaching the most vulnerable populations. And then you have insurers who are concerned about balancing cost containment, with while at the same time wanting to invest in preventive care and community investments, which, if you remember saying, those preventive care and community initiatives, they don't bring money, they don't bring the cold hard cash that technological advancements and innovations bring. But still, there's the cost to doing business. That's insurance are also trying to prevent there being a situation where they're spending a lot of money in doing business, and they're spending also a lot of money in investing in preventive care and community health initiatives that do not directly bring in money for them. And then you have policymakers who are navigating political pressures, with all the both people who are financing their campaigns, and their constituents, and what they want and what the constituents care about, while at the same time, having competing interests in trying to also ensure equitable outcome, particularly for vulnerable populations. And then you have the pharmaceutical companies who are, focused on ensuring profitability, while at the same time also trying to make their medications as affordable to a large number of people, and also having such that they're able to get their medications out. Even though there's a lot of focus on pharmaceutical companies making a lot of money, they do want to have people use their products. So I worked in a pharmaceutical company before I came to the US, and they do a lot of programs that's geared towards getting their product out in the market. So it's not just about let's sell small number of product to those who can pay the most money for it. They do want to get as many of their products as out as possible, and if that's going to require reducing the amount of money just so it's more affordable, they are willing to do that. But there's still a lot of pressure on them to make a lot of money while conducting business. So these are your stakeholders. All of these people have different concerns, different priorities, and you have to kind of work with them in determining, okay, how do we get this done in terms of reducing, in this case, trying to tackle the problem of rising rates of diabetes and hypertension. So there are a couple of ways you can do this. As I said before, in an ideal world, all your stakeholders are working together with you. In reality, you take what you can get, and sometimes taking what you can get is exploring the different potential collaborations you can have with more different stakeholders. So one of your collaborations could be with policymakers, funding initiatives that would address food insecurity and access to healthy food, and they would do that in collaboration with nonprofits who would establish community gardens or subsidize healthy meal programs. Another option could be having healthcare providers integrate social determinants of health screening into routine visits, so that they refer your patients to nonprofit or government programs as a way to address of housing, food, and transportation barriers. Another potential collaborations could be with your pharmaceutical companies, collaborating with the insurers or healthcare providers to offer mobile app for diabetes management and connecting patients to real-time glucose monitoring and lifestyle coaching. Another collaboration could be between your nonprofit and your patients, having them advocate for expanded Medicaid or government subsidized insulin programs. Ideally working with policymakers on this. So there are different ways you can do your stakeholder collaborations. It's very, very unlikely that you get to the point where you have all your stakeholders all having the same buy-in and having the same incentive to do achieve your goal. A lot of the times you may have to pair up your stakeholders, or decide, okay, this is the one that is I'm most able to do with the stakeholders, and I may not be so able to do this with those with the other stakeholders. So it's really about making that choice and looking at it in terms of, okay, what can I get? It's like I said, it's a lot more of taking what you can get and being okay with that. So, and with stakeholder collaboration comes with ethical decision making. So, ethics in population health refers to moral principles and values that guide decision making as a way to promote health and well being, while at the same time respecting individuals' rights to health and autonomy. So, unlike clinical ethics that focuses on individual patient care, population health kind of looks at ethics from a broader issue of how is it affecting population groups, how is it affecting communities, how is it affecting societies. So ethics in population health or public health emphasizes collective goods, but it does this while still leaving room for individual freedom. So ethics in population health is not going to say down with individual rights. Let's only work with, where it benefits the everybody. That's not how ethics in population health works. Even though it leans more towards collective good, it still has to acknowledge individual freedom of right of choices. So it's having to do a balancing act between this. So it does require considering social determinants of health, and acknowledging the fact that it disproportionately affects marginalized population. It's not possible to have conversations about ethical decision making if it does not pay attention to how to populations that are disproportionately affected by things. So, ethical principles like justice, autonomy, and beneficence serves as foundation for assessing stakeholder actions and their consequences. So, when you are having conversations with your stakeholders and you're making decisions, and how do you work with stakeholders, understand that these ethical principles will serve as a foundation for assessing, where will the priorities of your stakeholders actions lean towards, and what would be the consequences of that. And sometimes making the decisions about, whether this aligns with your own goals, or whether this aligns with what it is that you're trying to get out of this collaboration. So there are a couple of ethical principles when it comes to population health, but for the purpose of this class, we're just going to focus on five of them. The first is beneficence, which is all about promoting health, promoting well-being of the population, non-maleficence, which is about avoiding harm to individuals or community, autonomy, respecting individuals' rights to make informed decisions for them about themselves and their health, and justice, which is ensuring fair distribution of resources and health outcomes. And the fifth one being equity, which is addressing systemic disparities as a means to achieve health fairness. So the concerns and priorities of your stakeholders is very, very much influenced by the theories of justice and equity that they lean towards, and the theories is very much influenced by the ethical principles of how it is that it's influencing the way they lean towards. I'm going to explain that in a bit. So, in practice, there are no stakeholders that are just on one end. For instance, you may think, oh, with pharmaceutical companies, there will be libertarianism because it's all about making profits, it's all about market driven. But it's very, very unlikely that there would be purely libertarianism. There may be a bit of utilitarianism that is also going on with them, or even fairness as justice that may be going on with them. So you need to engage with your stakeholders, knowing that some of the times their priorities and their concerns may be being influenced by multiple factors and they may have multiple ethical considerations for that. And all of this combine all of these elements of principles and framework will influence the decisions that they make when it comes to addressing complex issues in population health. Um, let's say you have you're trying to make a policy that is going to prioritize equity, in which case you're going to consider the framework of justice as a fairness, but at the same time you also want to you want practical outcomes of it, in which case you're going to consider utilitarianism, and also at the same time you want to account the fact that people still want to have their individual freedoms in making decisions for their health, in which case you have to also bring in libertarianism. When you are engaging with your stakeholders, you may find some that are more leaning more towards equity, some that are leaning more utilitarianism, and some that are leaning more libertarianism. But at the same time, you need to work towards finding a common goal that works for as much as possible all of these three ethical theories and frameworks in order to achieve what it is that you're trying to achieve, knowing that some of your stakeholders probably have one or two ethical principles or one or two frameworks that they are leaning towards. So, understanding these frameworks will help ensure that the decisions that are made through these collaborations are ethically sound, that they are equitable, and they align with the goals of justice and equity. So this is like a very brief table that shows you where each of these theories are strong in. So you have almost all of them are strong in beneficence, as you can see, but with non-maleficence, utilitarianism is kind of moderate in terms of that. Autonomy, the utilitarianism is kind of weak on that, and capacities is strong on that. So when you are choosing your stakeholder, depending on what it is that you're trying to the goal that you have, you may want to look at a stakeholder that is strong on autonomy, and that is and maybe moderately strong on justice. You may want to look at a stakeholder that is strong on non-maleficence and moderate with autonomy. So it all depends on what it is, what your goal is, what your population health goal is, and trying to figure out where will your stakeholder more or less lean towards in terms of determining who your stakeholder is going to be. You probably do not want to have stakeholders that are too similar to each other, because what happens is that you will not be able to have the benefit of a different perspective of solving the problem, which means that when it comes time to going out of your collaboration to sell it to the general population, or even to sell it to policymakers, for instance, or trying to get a law policy change or a law passed on it, you're going to meet a lot of resistance because the people that you have collaborated with in your stakeholders have not given you the opportunity to see different perspective, and you were not able to refine your policy as best as it can be. So it's always advisable to have collaborations with multiple stakeholders, so that this way your end product is more refined and has been able to as much as possible address different people's concerns and different people's priorities. So that is where we end for this module. I hope you had a good time with it as much as you can. If you have any questions, please let me know. You can post it on the Q&A board and I will respond to it. Have a lovely day. Bye.